I called you yesterday afternoon, but you weren't home. Where were you?
At the dental clinic. The dentist talked to me about how important dental health is for us pregnant women.
Dental health?
Well, she says if people really look after their teeth, you know, get them cleaned regularly and take care of problems before they really get serious, they're less likely to need dentures down the road.
Sure, but who can afford to go to the dentist for checkups? I don't go unless I have to.
Well, getting a checkup once or twice a year can actually save you money. It's cheaper than waiting till things get really bad and you need a filling or a root canal. A whole mouthful of fake teeth?
Fake teeth? My grandmother had those.
She also says that if your teeth and gums are bad to start with, they'll only get worse when you're pregnant because of all the hormonal changes.
Huh, I never thought about that.
At the clinic, they get special training to work with pregnant women. They can really help you keep your mouth and teeth healthy.
Really? Do you think they have any appointments available?
Sure. I didn't have to wait very long, but you should probably give them a call today.
I think Josh is finally napping. I'm worn out too.
I think my little guy's asleep too.
It's just like magic. A bottle of apple juice and he's out.
You give him juice at nap time?
You bet. Besides, juice is good for kids.
Have you heard of baby bottle tooth decay? My dentist showed me some pictures. They were awful.
Are you kidding?
No, she says putting a baby down to sleep with a juice bottle is the fastest way for him to get cavities.
But he'd never sleep without a bottle.
Well, when I give Christopher a bottle, I rock him. Then I clean his gums and mouth out like this. Then I lay him down and he goes right to sleep.
That might work for a nap, but what about when he wakes up crying in the middle of the night?
Well, I try different things. A bottle with water one time, a bottle with milk in it another. But I always follow the same routine. By cleaning his mouth out right afterwards.
I don't know. It sounds like we'd have to make some big changes in our routine.
Well, I'm sure it will take some adjusting for the two of you. But it sure seems worth it. A lot better than having his teeth get damaged.
Well, now you've got me worried.
Don't just take my word for it. Talk to your dentist.
I'm going to.
Here we go. Airplane coming in for a landing. There we go. That's Grandma's good boy. He's eating so well these days. Are you doing anything to clean his mouth?
What do you mean?
Well, now that he's eating cereal, it would be good to clean those little teeth every once in a while. You can use a finger brush or a warm cloth, like this.
I thought his gums would be too sensitive with the teething.
This actually soothes his little gums.
You know, I've seen some tiny baby toothbrushes with really soft bristles. Should I get one of those?
Sure, if that helps get inside his mouth, that would do an even better job of keeping his teeth clean.
Thanks, Mom. It's a good thing she doesn't spoil you.
His heart sounds great, like clockwork. I looked in his mouth and it looks like his teeth are coming in as they should. But 6 teeth? That's typical for 12 months. It's time for a visit to the dentist.
Really? Is there something wrong?
No, it looks good in there. But we recommend you take them in for a first dental checkup at around 12 months. Just to make sure everything's okay. It also gives children a chance to get used to the sounds and smells of a dentist's office while you're holding him. Makes it all less scary.
Will they do anything to him?
It's just a checkup. Sort of like a well child visit when you come to see me.
But I brush his teeth every day.
That's great. I know it isn't easy when they're this young and wiggly about brushing. The dentist will make sure his mouth is healthy and will let you know if there's anything else you need to be doing.
Okay. Sounds like probably something I should do.
I'll have the nurse give you a list of dentists our patients use.
Hi there.
Thanks for seeing me.
Oh, no problem. I'm happy you could stop by so we can chat before your visit next week. You have some questions?
Yeah. I've put off coming for a long time because, well, to be honest, I'm kind of scared of the dentist.
That's not uncommon. A lot of people have some fear associated with seeing dentists. Why don't you talk to me about what scares you?
Well, when I was a kid, the dentist that we went to was pretty old-fashioned. Going to the dentist was terrible. It kind of felt like being punished.
That's not good.
So when I became an adult, I swore I'd never go to the dentist unless I absolutely had to. Which isn't probably the best way to take care of my teeth.
And if you only go to the dentist when you're having a problem, you're probably already in pain and a little afraid.
That's true.
But if you get your teeth cleaned and checked at least once a year, it's a lot less likely that you'll have a traumatic problem. And during pregnancy, you are more likely to have problems, so it's a really important time to have your teeth checked.
Will it hurt?
Well, I can't promise there will be no pain whatsoever, but I can promise that I'll be very careful and gentle, and I'll tell you what I'm going to do before I do it. And if anything hurts, you can ask me to stop.
That sounds okay.
You know, you've already taken the first step in getting over your fear by coming here today.
You're right. I feel better about it already.
And finding a dentist that you're comfortable with is key.
Well, so far so good on that.
Great. We'll see you next week.
Welcome to this fun and informative program on the importance of oral health while pregnant and about your baby's developing teeth in the womb. In this program, you will find 9 short vignettes or shows. Each show is just 1 to 3 minutes long. They give you practical information on caring for your teeth and gums during your pregnancy and caring for your newborn baby's mouth. The shows also discuss how to take care of your baby's first teeth and the importance of regular visits to a dentist by you and your baby. We will also stress the link between the foods you eat and good oral health. We recommend that you view each of the 9 shows, but you can view them in any order you want. On the main menu, you will see 3 pictures. Roll your mouse over each picture to highlight each of the main headings. These main headings are: is my dental health important while I'm pregnant? Do I need to care for my baby's mouth? Fears and worries about going to the dentist. Click on the picture to bring up the show titles under each main heading. Then, click on the name of the show you wish to see. After the video ends, click on the back button to return to the show names. You can choose another vignette from the list, or click on the back button again to return to the main heading. Feel free to take notes as you view these programs, and enjoy the shows. Here is a summary of the main points raised by the 9 shows in this program. Brushing and flossing are important during pregnancy to prevent gum disease. Regular dental visits are important during pregnancy. Make sure you get fluoride in drinking water and toothpaste. Fluoride is not poisonous to your baby in the womb. It helps your teeth as well as your baby's. Eat more fruits and vegetables. Avoid sugary foods and drinks. Don't put your baby to bed with a bottle. Feed the baby first and clean his or her teeth before bedtime. Take your baby for a first dental visit around 12 months. It's important to remember that most of us develop a sweet tooth by the age of 2. Our taste buds are sensitized to sweets early, so a baby who is given bananas and apples at an early age will be satisfied with that level of sweetness. However, if you give your baby something with added sugar, like pudding or custard, he or she will crave very sweet foods throughout adulthood.